So, good afternoon, everyone. I want to thank people who have found time to attend this session, the intersection of mental health and COVID-19. But I also want to thank my panelists who have spared time to come and speak to us about mental health in the context of COVID-19. Before I say much, I'll introduce myself and give the panelists the opportunity of introducing themselves. I'm conscious about time because we took a lot of time trying to figure out technology, but here we are nonetheless. So I'm called Dr. Kenneth Kalani. I am a psychiatrist and a senior medical officer at Ministry of Health, Mental Health Division. I'm going to be the session chair for today. I would invite my panelists to quickly introduce themselves. Then we can go straight direct to the discussion that we meant to have today. So I'll start with Dr. Benedict. Kindly unmute and introduce yourself. Over to you.
Hello, good afternoon. I am Dr. Benedict Akimana. I'm a psychiatrist and a mental health advocate. I'm happy to be here.
Thank you, Dr. Benedict. Maybe what he has not mentioned is that he works with Utawika National Referral Hospital. Okay. Okay, so that's how Dr. Benedict looks like. So, Dr. Hafsa Lukwata.
Yes, good afternoon.
Dr. Hafsa, we can't hear you. Please unmute.
That's terrible. Sorry, my colleagues. Dr. Hafsa Lukwata. I'm the Acting Assistant Commissioner, Mental Health and Control of Substance Abuse here at the Ministry of Health. I'm a public health specialist, and I'm very glad to be here with the rest of the group.
Thank you, and you're welcome, Dr. Hafsa. So, Dr. Hannah, kindly unmute and introduce yourself.
Kalani, thank you so much. My name is Fahmi Hanna. I'm also a psychiatrist by training, and I'm based at the headquarters of the World Health Organization in Geneva at the Department of Mental Health and Substance Use. I work as a focal point for mental health and COVID-19.
Thank you so much, and we're happy to have you join us from all the way from Geneva. Then Barbara, kindly unmute and introduce yourself. Barbara, kindly unmute and introduce yourself. Okay.
Good evening, everybody. My name is Barbara Kalumba. I am a counselor, currently serving as the Vice President of the Uganda Counseling Association. I am a frontliner with COVID-19 response team. Happy to be here.
Good to have you, Barbara. So without much ado, we shall go direct to our discussion for today. We know that the COVID-19 pandemic in Uganda has disrupted livelihoods and deprived people of the usual resources to cope, with the daily challenges of life. The general public basically has experienced fear and uncertainty from the disease, and even the lockdown measures that have been put across to calm the spread, to curb the spread of the disease. There's a lot of deaths that have been witnessed ever since this pandemic came in Uganda. Health workers are also working overtime during this time. Patients are stressed. People fear those with COVID-19, and people have resorted to all sorts of concoctions, prayer, steaming, and many other things as a way of remedy to curb the spread and even to treat COVID-19. These unprecedented events challenge our mental health And it's without doubt that, that this is the reason why we got the opportunity to discuss the intersection between COVID-19 and mental health during this COVID-19 era. So to start with you, Dr. Benedict Akimana, what is mental health, and what are the mental health effects of COVID-19 that we've noticed or registered during this time of COVID-19?
Thank you for the question. I thought before I talk about what mental health is, it's important that I also define what health is and show you how mental health actually covers the biggest part of health. And health is a state of complete physical, mental, and social well-being, and not just merely the absence of disease. And you'll notice from its definition that the psychosocial or the psychological effect of health covers the two, the mental and social, okay? And what is mental health? It is a state of well-being in which you as an individual are able to realize your potential, okay? So when you woke up this morning, or when you took up the job of wherever you are, what is your potential? What is expected for you to fulfill? Are you able to do that? 2, can cope with normal stresses of life. Clearly, we know that COVID is the stress we are having right now, okay? And it's now a normal stress of life. So how are we coping with it? 3, you are able to work productively and fruitfully. From where you work from and whatever you deliver, are you actually able to deliver it, what is expected of you? And are you able to make a contribution to your community? Wherever you come from, you have a family, you have the children, you have the old people, grandchildren, and all. Are you able to actually make a contribution? So we say you are mentally healthy if you realize your own potential, you cope with the normal stresses of life, you work productively and fruitfully, and are able to make a contribution to your community. So clearly, how has COVID-19 affected our mental health? Remember, it has really caused a lot of disequilibrium between your mental health and definitely the environment. And this has led to a lot of instability. How has this instability come? One, there's lots of uncertainty that is happening because of the COVID. Day by day, things keep changing, okay? It's a new disease all over the world, a pandemic, and a lot of things keep changing. So quite a number of uncertainty exists, and the information people keep getting from wherever. 2, we still do have life-threatening survival instincts which are kicking in. Remember how we know that this illness is spread. A lot of things come in and threaten us. So you have to put on your mask, you have to make sure you have a lot of SOPs, you have to make sure you're not near people, you have to stay home because this is life-threatening. You don't want to leave the house. Your social life has been affected. So all these instincts are kicking in. When you wake up and you sneeze or you have a flu, you think, oh my goodness, this is happening, okay? 3, there is minimum information that is known. So quite a number of rumors have been taken as truth. I'll give an example. There was a client I usually see from the hospital. So the other day, I think the wrong videos that go anywhere. And so they send a video, they're like, oh my goodness, a person is dying every minute, okay? And this was really wrong. So quite a number of things of the rumors and even the medications are taken in as the truth, okay? The other thing is that the transmission mode dictates prevention of spread that leads to isolation and loneliness. Yes, because of how this disease is spread, a lot of our social lives have been changed. If you're ill, you will have to isolate, or wherever you are, quite a number of people should not leave homes because they could get infected once they leave. And it has driven a lot of social stigma, okay? Because I remember the first wave, what used to happen is whenever someone would test positive, they would send the army and the police and the ambulance, and this would really affect the people. Imagine your neighbors see this happening, what would happen? But still right now, it's still definitely driving a lot of social stigma because people are afraid of being around anyone who has had the illness. And believe me, it has affected many of us, very many of us. Yes, doctor, over to you.
Thank you so much, Dr. Benedict.
So, well, maybe, so what have been the mental health effects? I'll just quickly just tell you what it is. So one of the things, because we've been reacting to all that, a lot of stress has come through, okay? Because you wake up, you are afraid of how the day is going to end, how everything is going to occur at work. So stress has come through. There's been a lot of fear that has set in, definitely. And remember, once stress gets accumulated, it leads to different illnesses. Like accumulated stress will lead to depression. Of course, quite a number of us, anxiety has set in. We're really afraid of the unknown. We do not know what's going to happen. Quite a number of people, their sleep has been affected and their concentration because of the illness, and this is the effect on our mental health. Of course, those who had chronic health problems, they've worsened. And it's interesting to know that quite a number of people have opted to abuse substances. There's been an increased use of alcohol, tobacco, and other drugs. Of course, socially, some of them would believe that to cope through the stress, you have to go and take a drink and so on and so forth. Over to you, doctor. Thank you.
So thank you so much, Dr. Akimana Benedict, for highlighting these very important things. One thing I pick from your discussion here, you point out that we cannot have health without mental health. So mental health is part and parcel of health. The other thing I noticed that there are very many changes that have been put across to there are many things that have been put across to try and curb the spread of COVID-19, but even these measures are a recipe for mental illnesses or mental health challenges. For example, the social stigma, we have a campaign here called the Tonsembera campaign that literally usually means that don't come near me. So this has driven social stigma, and that possibly can cause mental health, because as mental health experts, we ride so much on the support we get from social support to protect our patients and even people with other mental health issues. I also noticed that there is prolonged stress during this period from all corners, from work, from home, from everywhere. There is prolonged stress, and prolonged stress can lead to distress. And once you're distressed and you have this, your coping strategies are challenged, and people, the stress is beyond the coping strategies of people. And so we are seeing very many mental health issues coming up because of this. So thank you so much for highlighting this. And I want to go on to the next panelist. So Dr. Hafsa Lukwata, this one is for you. You come from the Ministry of Health, and you head the mental health division. What has Ministry of Health done to support the mental health of persons affected with COVID-19 during this COVID-19 era?
Okay, thank you very much, Dr. Kalani. Thank you very much, the organizers of this conference. It is, for me, I'm so gratified that we are having such a discussion, and I'm so happy. And I don't know the kind of people that are listening in, but I hope it is lay people or people who are not really the mental health, with so much mental health background, but just with interest. There's something that I've noted over time, that the words mental health and mental illness are used interchangeably, and yet they are totally different. Each of them is on the extreme side. But as we all know, mental health, many people are between being very healthy and being very ill. Many people do not achieve the mental health part of things as have been defined by Dr. Akimana, but certainly they may not meet the criteria for illness. So many of us actually lie in there. And when it comes to epidemics, many times people move towards the ill side, we tend to have many problems, many mental health problems, and so they need to be addressed. So as a Ministry of Health, wherever there's an epidemic or a situation which is like requires an emergency care, we usually set up task forces. We usually revamp the task force. There's what we call the National Task Force. And in there, we have different committees or pillars. And luckily, the mental health and psychosocial pillar is actually one of those very key, important pillars that are set out to respond. We all know that once there's an epidemic, the district where, in as far as we are decentralized, the district where this has occurred actually loses, I'm going to say loses its power to control, respond, and instead the center, that is the Ministry of Health, actually takes on the mantle. So this time around, it is even more than just the Ministry of Health. It is now there are so many government departments that are involved. I think it's now His Excellency, the President, who is taking on the mantle, and then plus, of course, the Office of the Prime Minister and many other government departments. So as a Ministry of Health, ours is to, yes, as a mental health and psychosocial support pillar, we have set our major role is to provide care, to the people who are undergoing events, who are having problems with their mental health, with their emotional, and who have needs. Of course, we do not only cater for patients, but also families and communities, and we have been informed, and we have actually seen that once you offer mental health and psychosocial support to people, you help them heal faster, you help them deal with their stresses much better, and also we wanted to use the word survivors. I don't want to listen to this, but people come out with when they're a little more positive, when they've learned something, they are not complaining, they are just thankful for even the little that they've gotten, if any. So there is, as a Ministry of Health, we have the mental health and psychosocial support pillar, and this pillar is actually composed of quite a number of specialties or people with different specialties. We have the psychiatrists. Dr. Kalani is part of our group. We have psychologists. We have counselors. We have the spiritualists or people, especially people who use the religious groups. So the religious elders, some are counselors. Then the teachers are very key in there, and of course, general healthcare workers. I've not mentioned the nurses, but okay, general healthcare workers can also be part of members of our team. And maybe Dr. Kalani, you haven't asked for this. What do we do? I've already said yes, we offer counseling, but we also do a very immediate part of work that we do is actually offering the psychological first aid for those that are being, immediately affected. We did this quite a lot for those political goers who are in isolation and quarantine in the first wave, because it was a very rare occurrence. It was not okay to be the isolation unit, and it was like a sin because, as you've already rightly said, you would be picked by the army ambulances, the army groups or ambulances that are having their sirens moving around. So it's like a death sentence, and we had not known quite a lot of what was happening then. So being in an isolation was something very terrifying. And so we would offer psychological first aid. And in here it was look, the three principles, look, listen, and link. So we did quite a lot of this during that time. In this current wave, we are mainly counseling. I think it's mainly the counseling. And linking, we link family members with their people who are in isolation, because remember, once you enter a CTU, that is a COVID treatment unit, you'd you may lose contact with your patient, with your colleague that you're staying with, a family member. So then sometimes you need to link you with this person, and sometimes it's still through the phone, or there are intermediaries. You cannot go into the community. So the mental health and psychosocial actually does a lot of that middle work. We link people to their loved ones where possible. Then we also we are the listeners usually. So when people have things that they need to discuss, it is us, the team, that they meet and discuss, and we tell the problems that they are going through. It could be about the food, could be about the way they're being treated, it could be about maybe the environment generally. So it is the mental health and psychosocial pillar that actually addresses some of these things. And of course, it is two-way. The health workers may want to communicate something to the patients, and the other way around. So it is this pillar of ours that so briefly, time of discharge, there's back into their society. Usually there's a lot of stigma around people who have been in the treatment units. People are fearing to be infected, and so sometimes, especially in the first wave, people were not even allowed to go for their basic needs. Like their money could not be accepted. They could not go to the wells. They could not go to the market. So like in that case, then the mental health support team would come in to really be supportive and help this person settle in their communities. Now we have the work environment. There are quite a lot of things that are happening. Some health workers, some managers, business managers are not allowing people to get isolated once they are sick. And even sometimes they don't want to give them time to rest and heal from whatever they're going through. But even then, some are being exposed directly. So the mental health and psychosocial team comes in here handy with, of course, messages, and we write some messages out and calm people down, inform them about what is happening. There's been a lot of vaccination. People are shunning away from the vaccination. So it is my pillar that is actually responsible for informing people about there are not so many dangers or side effects to this vaccine. So briefly, that is what the ministry thought. And over to you, Dr. Kalani. Thank you.
Thank you so much, Dr. Hafsa, for taking us through what the ministry has done. And clearly it's a mouthful. And also thank you for distinguishing between mental illness and mental health. I hope the listeners got the clear distinction between those. What I get from your discussion is that when you point out that when this pandemic started, we set up a response pillar that is called the mental health and psychosocial team. And this sub-pillar put up a team of different mental health experts to offer support to those who are affected and infected by COVID-19 at that time. I also pick that you've helped people in CTUs, in the COVID treatment units, and you helped those that are being discharged reintegrate into the community. One thing I want to find out now is that during this time, we are in phase 4 of community transmission. And basically this means we are in the phase of widespread community transmission. And we know that the fear and stigma is so much, particularly to those within the communities. And we've also enrolled a strategy called a home-based care. That means that people who have mild disease will remain in the communities and not exactly come to the COVID treatment units or hospital. But yet the communities, some of these communities still stigmatized, and patients experience a lot of fear. The experience of having to check themselves every day, you wake up and they are fearing, the experience of possibly infecting their loved ones within the confines of the homes where they are getting care. Are there any strategies that Ministry of Health has come up to support these people at the community level? Over to you, Dr. Hafsa.
Yes, okay. I could answer this very briefly because there is a pillar that is the home-based care pillar that was set up. It came on a little later, but it was clearly set out to actually link people or manage people within their homes. And luckily, the mental health and psychosocial support pillar is part of this. And we contribute towards the wellness of people within their homes. And we are trying to make linkages. Of course, we cannot be everywhere. Once it gets into the community, then it involves so many people. And some of it is even beyond what we can control as government. So then the local leaders have to come into play. And here we are using mainly the VHTs. We are calling upon the VHTs because that's our first line of call at the village level, plus of course some from civil society organizations and non-government organizations come in handy at this level. And here, as mental health and psychosocial support, we have we just need to provide guidelines really on how to do it. And of course, this is not cast in stone. Different communities can pick out what is feasible for them to work with. And we only get reports at the ministry for what they are doing in the different communities. But what we have done, what we've had lately is that there are some self-help groups that have been formed where people with the same problem can actually interface and talk about issues. Some of this has been abused because we have had people sharing knowledge, I think even wrong knowledge on type of herbs, the type of medication that they are trying, the concoctions. But as a ministry, we are guiding here and then. For as long as we get these reports, we tend to give information, we tend to correct the information that is therein. And so we cannot easily reach the homes, but this is something that we try to do to support the home-based care. We're going to them through the VHT system. Yeah, thank you.
So thank you so much, Dr. Hafsa, for that clarity. I pick that we have a VHT structure, which is the village health teams. It's the lowest form of health providers in the communities. Maybe you're going to train them to offer support at that level. So this is very wonderful intervention, and we hope that we manage to succeed at that level. So I just want to go to Geneva, and ask Dr. Hannah, you're from Geneva and you come from WHO. I just want to ask, what are the WHO strategies that have been put across to strengthen mental health preparedness in COVID-19 internationally?
Dr. Kanani, thank you so much. I prepared a very brief presentation that I wish to share with you and colleagues in the coming 10 minutes. I hope this is okay.
Okay, that's very fine. Yeah.
As rightly mentioned by the previous speakers, is that there are huge links between COVID-19 and mental health. One of the issues I noticed was not highlighted by the previous speaker is the issue of actually having people with severe mental health conditions more prone for severe COVID-19 infection and also having higher mortality due to COVID-19. That's why this is a key and priority group recommended by WHO in its roadmap for vaccination. But many of the previous speakers has mentioned that COVID-19 mental health manifestations do exist among the general population, and that's confirmed by many of the ongoing studies in numerous countries. Symptoms such as symptoms of anxiety, of depression, of post-traumatic stress disorder, and psychological distress are widespread among population group due to many reasons, whether it is worrying about oneself, health, worry about loved one, disruption of social support systems, effect on livelihood livelihood, and we know that adversity and impact on livelihood is one of risk factors to mental health condition. Loneliness, one of the risk factors for mental health conditions. But we don't see this only acutely. We see also a link with many of the long-term mental and neurological aspects of people exposed to COVID-19 infections themselves. So WHO has included among the COVID-19 clinical manifestation, mental and neurological manifestations, including in short-term and including in long-term. Short-term, such as in delirium, for example, or headache, but also there are issues such as long-term headache and fatigue and anxiety and depression in long-term COVID-19 cases. So the link is really related to people directly infected, indirectly to generally within the population, and people with severe mental health condition are exceptionally affected as well. Dr. Benedict has kindly mentioned also about the issue related to substance use and COVID-19, and we see emerging reports from countries about this, about people using negative coping mechanisms such as alcohol or such as addictive behavior, such as online gambling or online gaming to cope with stressors that lead to addictive behavior, and we see emerging studies about this. And we are learning more and more about post-COVID, and we know now that part of the post-COVID syndromes or long haulers or people who tend to have long-term symptoms related to COVID-19, that mental and neurological manifestations are among these symptoms as well, including fatigue, including depressive symptom and anxiety symptoms. WHO member states last month, the 194 member states have discussed, this is the first time that mental health is being discussed as part of the emergency agenda. This is the first time since WHO was established that the countries, the member states, the ministers of health of the 194 countries has requested to include mental health as an agenda item while discussing emergencies. So the new mental health action plan was updated until 2030. With new set of indicators and new actions recommended for countries. And in fact, one of the indicators that all countries of the world will be reporting from now on about every 2 years is mental health and psychosocial support preparedness, allocation of human resources, financial resources, monitoring of plans, putting plans for mental health and psychosocial support. And this is what the 194 member states has agreed on last month at WHO. But COVID-19 is affecting mental health in a different way. When we asked countries about disruption of their essential health services, among all areas of health work, all areas, you see that countries has reported that actually the most disrupted area of health, the most frequently reported one was mental, neurological, and substance use. Slightly higher than actually neglected tropical disease. Mental health, neurological, and substance use was the most reported service as disrupted globally, unfortunately. Many things can lead to this. The neglect, perceiving this area as less important, decades of stigma, decades of underinvestment, but globally, this is the current status. This is the most disrupted area of work in the whole world in essential health services. If we zoom in, go deeper in the data, when countries report that this service is disrupted, what is actually disrupted? Globally, the news are bad. What is most disrupted is what we need the most, the services for the most vulnerable, services for children at school counselor, because many schools has been disrupted around the world, services for older adults, services for children and adolescents, and almost 50% of counseling and psychotherapy services around the world has been disrupted. Suicide prevention programs has been disrupted. Programs related to substance use in around 34% of the countries has been disrupted. Sadly, one of the most disrupted areas are actually the service for the most vulnerable and prevention promotion services. But there are some good news. Like we heard from Dr. Hafsa about the integration of mental health and psychosocial support in Uganda plan, Majority of countries are doing this. 90% of countries of the world are integrating mental health and psychosocial support into their COVID-19 response plan. The sad news is that only 49% of countries are allocating financial resources to implement such plans, and only 20% of the countries have allocated the whole financial resources required for this plan. So there is slight increase compared to this data when we measured last year, because last year it was 17%, slight increase, but still 80% of the countries are not able to fund fully this plan. We are talking about huge gap in financial and human resources. But the type of services countries are implementing are similar to what Dr. Hafsa has shared with us, orienting responders on mental health and psychosocial support, providing MHPCS services to people in quarantine and isolation. Half of the countries are doing actually research, but the gap we see is that very little percentage of countries are actually studying substance use or neurological disorders in relation to COVID-19. So we still see these areas as public health blind spots, although they appear to be very relevant to COVID-19. WHO included mental health and psychosocial support as part of the strategic preparedness and response plan for COVID-19. So one of the monitoring indicators you will see in the SPRP, monitoring and evaluation framework, is percentage of countries with multi-sectoral mental health and psychosocial support technical working groups that involve different sectors, meeting regularly, have allocated resources, and evaluate the response. In fact, Uganda is one of the reporting countries in this indicator last year and this year. And we have in Uganda mental health and psychosocial support technical working group. But this is part now of the strategic preparedness and response plan. WHO also support rapid deployment mechanism together with other partners in the United Nations. Actually, Uganda last year has benefited from this deployment to support the refugee response with UNHCR. But as you see, the African continent in general has benefited from this rapid deployment of MHPSS expert during last year, and we continue to provide this support during this year as well. 27 countries has benefited from this rapid deployments of MHPSS coordinators. We continue to do scale up, and in neighboring South Sudan, for example, for the first time, despite the COVID-19 response, services started to be provided in 7 different South Sudanese states outside the capital Juba. Similar scale up has been happening in other emergency affected countries such as Syria through integration of mental health into primary health care using tools such as MHGAP Humanitarian Intervention Guide, which would still be relevant during the COVID-19 response. WHO developed a wide range of resources from the children's storybook, which is available in 143 different languages, one of the most translated books ever. And interestingly, this is also available in at least 8 of the local Ugandan languages, translated by many partners and local NGOs, not only available in the local languages, but also available in audio versions as well. Basic psychosocial skills, a comic book guide for COVID-19 responders from different sectors, again, available in numerous languages, a comic book for adolescents to use at schools, a guide accompanying My Hero Is You for teachers at schools and for parents at home, Living with the Times, a guide also for older adults and their caregivers to cope with COVID-19 related stressors. So we have across different age groups in numerous languages, including in some of the local languages in Uganda, many of the resources available. WHO also work with different pillars of the response to integrate MHPSS. So you would see in the clinical management of COVID-19, there is a mental and neurological chapter. In continuation of essential health services, there is a mental, neurological, and substance use chapter on how to deliver safe mental, neurological, and substance use services during the COVID-19 response. The survey data I just shared with you was published twice and available, including data from Uganda. I'll stop here. Thank you, Dr. Kolani, for the opportunity. Really a pleasure to hear from the good work that colleagues are doing in Uganda and be with you today.
Thank you so much, Dr. Hannah, for taking us through that. It was a wonderful presentation, and it's indeed very important to note that that mental health is now coming up, you know. I'm happy. For me, what I pick from your presentation, what takes it for me is the fact that persons with severe mental illness are at a risk of severe COVID disease. And I think that's something that as a country we have not highlighted, and it's something to take home. The other thing I point from your discussion is that mental health is discussed now as an emergency agenda, because this is, I think we are taking in the opportunity as mental health experts and the mental health fraternity. COVID has given us the opportunity to shine. I can put it loosely.
Indeed.
Because everyone is really distressed, and they are seeing the importance of mental health and psychosocial support in that manner. So it's very important. I'm also very excited about the Mental Health Action Plan 2030. I can't wait to look through it and see what plans you've had in there. I also noticed that mental health is disrupted. Mental health services have been disrupted globally. I thought it was something that we're grappling with as Uganda alone. I can tell you for a fact that most of our mental health treatment units were taken as isolation facilities or treatment facilities for COVID. Yeah. And as a result, the treatment of the mentally ill was terribly compromised. The fact that even there is no place for admission in some of these patients with severe mental illness, and the fact that we only have one national referral hospital, all patients end up being admitted there. And you can imagine the congestion there in Butabika Hospital. And now with the COVID outbreak, it's a challenge. But it's interesting to note that all other countries also faced similar challenges, and we're also struggling to overcome these challenges to ensure that we provide proper mental health care services for our patients with severe mental illness. So thank you so much, Dr. Afami, for those very wonderful words and the presentation that you've shown up.
Thank you.
Now, next I want to go to Barbara. Barbara has been quiet all along through the presentation. We've really pointed out all the issues, all the mental health issues revolving around COVID. I think we can agree that almost everyone is stressed during this time because of the measures that have been put across to curb the spread of COVID-19, but also because of the nature of spread of COVID-19 itself that dictates that we isolate and don't get close to each other. Now, how can one stay mentally healthy or cope with the ongoing stresses during these COVID times? Barbara, I throw this question to you.
Thank you, Dr. Kenneth, for the opportunity. And I thank everyone who has presented. It's really a beautiful panel. How can one stay mentally healthy with the ongoing stresses during the COVID-19 era? I would want to start by saying that COVID-19 in this second wave has disposed us to palliative counseling, which we had not anticipated to do this soon, depending on the stages of diagnosis, also on the stages of sickness when a person is sick, testing, right from the testing time to the treatment plan and how they recover or when they lose the battle. It has pushed us to the extremes, because now we have to think of palliative care as an inclusion in caring for patients or people who are suffering with COVID-19. But how can one stay mentally healthy in this epidemic? I think the first thing that we have to do is to identify the stressors. And me and you will agree that some of the stressors are known to us, like bad news, like social media, where people just put in the wrong information and it spreads from one group to another. So being around people that are very negative. So if one can identify their stress triggers and then try to avoid them, I think that is one of the ways that could help them to stay afloat in this COVID-19 era. But also the other thing that we can do is to keep engaged because of the lockdown and everything that is happening. Schools are closed, offices are closed, some markets are closed, movements is very limited. we need to keep ourselves engaged. So we need to draw activities or things to do for the day. What time do we wake up? And when I wake up, what do I do? When I have finished having breakfast, what else can I do? If the children have to be engaged in school, what time do they get engaged in Zoom or other school-related activities? When do we go out to do exercise? When do we take walks? When do we have meals? Because of the lockdown, there is a laxity in sleep patterns, and that should really be watched, because people are not waking up to anything, so they rather sleep late or extend their sleep hours, which is not a very good thing. So we need to know how to do that. It will be very nice if we have a list of things that we can do to engage us. But the other thing is to reach out to friends and family. It is very important that even with isolations, the phones at least can get us to where we want to go, or get us to talk to the people that we want to talk to. So it would be nice if you keep in touch with family and friends, make a call every day, find out how they are. If someone has been sick or someone has tested, how are they feeling? How are they coping? Is there any help that you could offer? Because the help may not be physical, but you could help, probably provide some food or some essential help that they might need to go through the day. And the other thing that we could do is to challenge the negative thinking. It comes from the beginning. The moment everyone thinks, when I have COVID, I am dying. Yet not everyone who has COVID is dying. So we need to challenge the negative thinking, because that has also triggered a lot of anxiety and panic attacks, which contributes a lot to the disillusion that comes up with the COVID-19 ruminants. Those that have been able to go through and come back, they get disillusioned, having lots of questions of, why was I the one to survive? How am I going to pull through? And of course, with the stigma that the community has brought in, or the home itself. So we need to be able to challenge that negative thinking. And the negative thinking is by saying things to yourself. We have a saying that Barbara has to help Barbara. So if Barbara is not feeling well, then Barbara has to speak to Barbara to feel well. So I am alive today, I am strong today, I am getting better, I have overcome for a reason, I will go through this. And you keep saying good things about yourself, or we can ask friends and family to send us positive messages that can keep us going a day at a time, and that will help us challenge the negative thinking. And I believe so much in creating time for self, because while we're trying to run around, manage family, manage the profession, manage everything, we tend to deprive ourselves of time for us. So it would be nice if one can create time for themselves to do exercise, to wind down, probably watch a good movie or take a walk, do things that can help you to connect with yourself. That would be a very good thing. And some do that by drawing from their religious beliefs. So others will go for probably prayers or whatever they do with their God. But the other thing that we also need to do is to mind the diet, because of not being in a rush to go anywhere, or not having a proper schedule for the day. Some people tend not to eat, or others tend to eat too much, because what is there to do? After all, COVID is going to kill us, But it's very important that we mind the diet. Even the children and the vulnerable groups, let us try as much as possible to encourage them to take the fruits and the vegetables, to get out in the sun, do a bit of exercise, and continue to be alive, because we are alive in the pandemic. That would be very nice. The other thing that I wouldn't want to forget is we should be able to deal with the loss, grief, and the loss and grief process completely. Because when we lose people during the pandemic and we're not able to grieve over them, or we don't get to terms with the losses, that is going to have a psychological impact on our lives now and for many years. So it is very important that if a death has happened in a home or in a community, we are able to know why the person has passed on, and help the family or the friends or community to deal with the process of grief. Of course, now with the restrictions and everything, we can't gather or go for burial and what, but we can find ways of dealing with that grief and letting it out than letting it sink in. Yet some people are still battling with the disease and there is a lot of isolation. So it will be very important that we deal with the loss, death, and be able to close. When we close that loss, I believe a few of those and more will be able to help us cope with the ongoing stresses of COVID-19. Back to you, Dr. Kena.
Thank you so much, Barbara, for highlighting these strategies of coping during these tough times. And just before we go to the Q&A session, I would request the attendees to actually type in their questions if they have any questions or comment they want to make in regards to the discussions that we are holding. So Barbara, you raised very, very important issues. I see there it's important to schedule activities on a daily to prevent worry. I think scheduling activities also prevent worry because you wake up knowing you're going to do something. And I advise us to have positive conversations with ourselves. So despite these negative thoughts that keep coming, we keep reminding ourselves that you give ourselves positive information that will, enable us to go on the next day. I also get from what you told us that self-care is not being selfish. It's important to find some time and think about yourself, that you eat well, you enjoy. I think you do activities that you enjoy. It's part of self-care. And some people think of it as being selfish. For example, you have someone lying in the hospital and you're here thinking about yourself or doing something that you enjoy. I think Barbara puts it right, that if you do not take care of yourself, you will not have the capacity to take care of those that you want to take care of, because you break down at the end of the day. So that is very, very important. Then you advise us to eat well. Your body needs a good immunity in order to respond and cope with these stressful experiences. And so a proper diet is always important that we recover. So thank you so much, Barbara, for highlighting these things. Before I go on to the next question, there's a question here that someone has pushed at, someone has sent in the comments, and it's related to your presentation. So before I let you rest, I just want to ask you this question. So someone is asking, I'm a medical student who has been having both my parents and two of my sister ill. So I have to inevitably set into care, and I ended up contracting the disease and got so worried and distressed. I'm so worried now because it's hard for my mind to settle down. How can I cope with this worry? Barbara, someone is calling out for very quick, in 1 or 2 minutes. How can this the medical student cope with this worry? The parents are sick, the sister was sick, so they had to take care of their parents, but in the event when they are taking care of the parents, they also contracted the disease and they have to deal with their own worries now of having the disease. How do they cope?
What I can say, maybe 2 or 3 things that I can say to the medical student is when we volunteer to come as frontliners to help the people that are battling with the sickness, we expose ourselves to chances of contracting the disease. So I don't know if you knew that, but it's one of the things that we're told, even as frontliners. Now that you've contracted the disease, it doesn't mean that you are going to be terminally ill or go through the stages that probably they've gone through. You could have a different way that you're reacting to the disease. What you have to do is to have a ruminant, I refer to it as a ruminant spirit, because you have been able to help them set into care, but you also now have to help yourself get out of the worrying and stress. The fact that you've tested positive, it doesn't mean you're going to die or going to be, on oxygen and ICU and all those things, but you can actually pull through with the treatment protocols that have been set out, but also think of yourself as a person who was available to help. And because of that, you'll be able to pull through. The worrying and the distress will not go away in a flash or in a day or two, but it will also be nice that you seek for professional counseling. You could call me or call a professional counselor to engage you on a one-on-one session to help you be able to really identify your triggers of distress and then find solutions on how to handle it so that you can get back to your normal functionality. Back to you, Dr. Kenny.
Thank you so much, Barbara, for answering that question. And I hope it helps the medical student who is very worried at this point in time because they've contracted COVID. I'll take this time to give the opportunity to the attendees to ask some questions. I can see there are questions coming in through the chats, but also if you want to ask a question, you can raise your hand and we shall note, I'll see the hand up and pick you up to ask your question or make your comment. Someone again is asking, what kind of exercises help take distress? I don't know who can want. Benedict, you want to take on this?
Right. What kind of exercise would take out the distress?
Yes.
One of the easiest thing our president told us was to do press-ups at home. But the other thing we can do is you can skip the rope. Skipping the rope does help. I encourage those because those you can do them from home. Of course, as opposed to walking and so on, if you can go around the house, that would help. Ideally, taking a walk or running would actually help. But we are staying home because we don't want to get the infection. So we can skip the rope, we can walk around the house, and we can do press-ups or sit-ups like the president showed us. And that would really help us. Over to you. Thank you.
Thank you. And I believe these responses are contextualized to Uganda. I know we have some international listeners or attendees, but here we're on lockdown. So we have restrictions on the number of exercises we want to do. For example, gyms are closed and you have to do the exercises within the confines of your house or home environment. And so that's why I think these questions came up, and Dr. Akimana, thanks so much for that guidance. Someone else is asking, and I think this question goes to Barbara. You've mentioned about good nutrition. What about the urban poor? What about those who have lost employment?
Yes, I've mentioned about nutrition.
Yes.
Okay, thank you, Dr. Kenneth. I've mentioned about nutrition, and in the context of the urban poor and those that have lost employment, I still believe we have lost employment. Yes, we are urban poor. Yes, but we're not sleeping on an empty stomach. What we can actually do is to try and beef up the meals that we have. For example, we can do foods like silverfish, locally known as mukene. It is a very good protein that can actually help us in the fight of the infection. The vegetables that are readily available, even in gardens now, in the village where I stay, people have opened up their gardens that people can actually come and pick the green vegetables and be able to supplement on their meals. It's a season for fruits. I am not saying you have to go to the market or to the supermarket and get all these things, but you can improvise a way of making sure that at least there is a fruit a week or twice in a day. But the vegetables, yes, they are readily available. They can be got. And the silverfish, I believe even the urban poor, a cup of silverfish, which is sold at 500 shillings, when prepared very well, can be able to, do good to a family with other foods, maybe posho or whatever they have to eat. So that good nutrition does not necessarily mean chicken and liver and all those other foods, but even with beans and posho and silverfish and eggplant, and the leafy vegetables, we're able to have a good meal, which is a good nutrition in the fight against the infection. Back to you, Dr. Kenan.
Thank you, Barbara, for answering that. So I think the take home here is we should not equate good nutrition with wealth. I think looking at the brighter side, looking at the positive side of this pandemic, if we don't have enough money, let's take the time to eat healthy and eat cheap things like greens, and eggplants and all these things. Uganda is a very blessed country and we have fruits all over, given the season of fruits. Let's take this time to eat healthy and not eat KFC or fried things only. So thank you, Barbara, for that question, for that response. So another question is coming in, and I should admit that the chats are really, really busy. I see questions coming in. Barbara, you may want to log on to the chats and respond to the medical student. He or she is requesting for your phone number so that they can reach you out for professional help. Okay, I can see you're typing, thanks. So there's another question coming in. What plan is available for those who have to cope up with the grieving of a loved one when you did not bury and you had been denied the information when sick too, and the PTSD? So anyone can answer this, Dr. Hani, Dr. Hafsa, or Dr. Ben. People are worrying, how do they cope with grieving? Sometimes the situation here necessitates that some people do not even tell their loved ones that their loved ones are sick, for example. And you know how COVID can come up, the situation can change rapidly and someone dies without the family being prepared for the death. And because the burying procedure means that they bury you immediately after death, sometimes people may not get the opportunity to actually bury or have the chance to bury their loved ones. How do you help such a person cope with this stress?
Well, one of the simplest way to deal with stress is to find someone you can speak to about it. Yeah. A problem shared is a problem halved. And I've seen quite a number of people going through all this, and in one or the other, if you have someone who is going through that, please be there for them. Allow them to speak to you what they're going through, and that will help them cope with it in one or the other. So to me, it's because totally a problem shared is a problem halved.
So one of the strategies is
over to you.
Thank you. So one of the strategies you point out is share this problem and talk about it. Do not bottle up the feelings. You know what I understand from my neuroanatomy, and I remember that the brain has the lower centers and the higher centers. So if you do not share things, they are kept in the emotional centers, the lower centers. So it's important that you engage your higher centers by sharing, appraising the situation, and at the end of the day, you're able to go through it. Otherwise, if you keep quiet, that the grief will be prolonged, or it becomes complicated at the end of the day. And maybe you get anxiety or depression, which are all complications of the grief that would have been solved earlier on. So thank you so much, Benedict, for that.
To add.
Yes, Dr. Hafsa wants to add something.
Yes, I just wanted to add
something small to what Patrick has asked about. And I'm just saying that it is only this time that we cannot bury, but I am sure after the 42 days of the lockdown period, we shall have time to go and, pay our last respect to our loved ones. So I hope that time will help to, be part of the healing, and even meeting family and friends, and you mourn together, plus whatever these guys have talked about, the sharing and, mourning together, I think will help you heal. And certainly, mental health and psychosocial support is related with the bereavement support. We helped with the burials, but also with the family as they bereave. So you can get in touch with any of our people. The counselors are in place, or the psychiatrists, and Barbara was sharing her number. So these people can just help you with the situation. But also don't take it so terribly. Just accept it, and you could even pray about it.
Okay. So thank you so much, Dr. Hafsa, for the addition, and you bring in the aspect that even after the situation is calm, you can go and do what you did not do, so that you have some sort of closure with this thing that you did not, the opportunity that you did not have, you actually take it at that time. That will help you heal psychologically as well. Well, I'm just going to take two more questions and we close. I see our time is almost up. Someone here is asking that when talking about COVID and mental health, apart from the distress caused because of the disease itself, there are also a lot of people who are going through depression because of loneliness and abandonment, or just staying at home and not knowing what to do. And most of these cases, especially in teenagers, is being neglected by the parents or society as just overthinking. So they say they are just overthinking. So how can we improve the awareness regarding the seriousness of the issue, and how can we wake up the adult generation into taking such cases more seriously? Thank you so much for this interesting question. Dr. Hafsa, I don't know if you have any comment to this.
Okay, yes, I think I do. Personally, I'm dealing with some young people in my home, and this is one of the things they say, now television is boring. Now this is very boring. But as a country, we have an advert going on of Chija Kugwa. So it is like we are counting down on the days, and that is one of the strategies we've taken. Like Chija Kugwa, it will end, it will come to an end. So it is just a matter of time. So we are, helping ourselves through this time. I think, yes, recognizing that it is true that people are going through this is a problem, especially the young people. But what I have done as a parent, I have explained to them why we are in such a situation. So it's about, I think, explanation. For as long as someone appreciates why they are being put in such a situation, they will accept it much easier. And at the end of the day, someone can shelve it. Of course, it comes on again, but with frequent reminding, this is something that can happen. But the most important thing, I think, is to engage. We need to, I think this is a time when parents are most challenged, like those that were not engaging their children to do things that keep them at home, or do things that, where children can really express their energies and everything. I think this is the time that parents have to come up and think of ways. And it doesn't have to be the parents themselves. He can even push it back to the children themselves. He can task the children to find things that they can do that can engage them for that day, so that they can get tired, during the day they can get tired, and then they will be able to sleep, instead of just watching movies or whatever. Even if they even chose to watch a movie, it should be purposed. There should be reason why they're watching a particular movie, not just watching anything. So that is something that I have learned, and I wish many parents can learn. We need to explain to these children why we are having such a situation, and we engage them in some other things that can put away these thoughts of theirs when they come on. Thank you. Over to you, Dr. Karen.
Thank you so much, Dr. Hafsa, for those insights. I think on top of what you've said, I also point the fact that there is need to educate people about the signs and symptoms of mental illness. What one important thing that the person who's asked that question raises is that people are not aware of the signs and symptoms of mental illness. And usually brush it off as overthinking, funny behavior, and these things. And yet someone is undergoing through serious psychological distress and stress. So we need to scale up education and sensitization of parents, and we can do this through radio programs, through community integration and involvement, also through the community members to tell them. But also we need parenting classes. As you pointed out, I think people are challenged nowadays. I can't imagine, because it's difficult to challenge to parent the modern day child. Some of the parents who are parenting were parenting using the old style, and now they are mixed between the modern day child and the old style, where they were caned in order to actually understand certain facts. But nowadays children know that, corporal punishment is prohibited. They watch television, and indeed there are other means of disciplining a child than beating them. But we need to, teach parents these styles so that they can actually learn how to manage their children. Because I know that there is no one size fits all in parenting, but they take time to actually understand their children and give them the necessary parenting. So thank you so much for that. One question to Dr. Hannah. Someone is asking, what specific tools is WHO using to understand the levels of substance abuse and the types abused by the different countries? I think you saw a graph there where you're putting. Yes.
Thank you, Dr. Kalani, and thanks to the colleague who asked this important question. There are many tools, in fact, and as you know, we relied on our data and getting the data on governments. Governments are the colleagues who fill in the data in information systems and share with WHO. So we have, for example, similar to the mental health atlas, there is in fact a substance use atlas that include all the global, regional data and country level data on substance use in general. As part of the Global Health Observatory, if you get to the WHO website and go to the Global Health Observatory, there is actually an alcohol and health information system with data also available country by country related to alcohol. And regarding assessment tools, there is, for example, the UNHCR WHO rapid assessment tool of alcohol and other substance use in conflict affected and displaced population, a field guide, one of the key resources that you can use for this purpose. And the data I have been sharing today is coming actually from the Pulse survey, the WHO regular survey on continuation of essential health services during COVID-19. So as I shared, there are so many resources available where you can know about Uganda, and also Uganda in comparison with other countries in the region and in the world, available on the WHO website. Thank you.
Thank you so much, Dr. Fanny, for that response. So I think as we come to the close of this session, we are already 5 minutes past time. I'll just give an opportunity for each of the speakers. I first of all want to thank the speakers for finding time again to speak to us in this very, very important summit. But I want to thank the attendees for actively participating in the summit and sending in questions and spending time to actually go through all the time allotted to us, and we've reached the conclusion of this session. So just as we conclude, I want to ask the panelists just one question, and then you give your parting shot as well as you respond to that question. It's okay if you don't have a response to the question, but if you have a response to the question, it's very important that we get it. And then you give your parting shot in just 1 or 2 minutes, each of us. So the question I want to throw to us is that we've had a lot of these presentations now. We've seen the effects of COVID-19. We've seen the response that the country has put across, and we've also seen the strategies from the WHO to scale up mental health response during COVID-19. And we've also seen personal strategies that we can put across to cope with the stresses that everyone else is facing. How can we improve? Are there any gaps that we've noted in our response? Are there any, learning points that we have pointed out, and how can we improve the MHPSS service provision in the country? Because as it stands, COVID-19 may not go away today or tomorrow. We might go through this entire year with COVID-19, and we need to improve on the strategy. I know we've done so much, but what other strategies can we put across to actually improve the care? In 1 or 2 minutes, I'll just go through my panelists to give me that response. 1 or 2, if you don't have the response, okay, then you give your parting shot as well, and then we close this. So I'll start with the Dr. Benedict Akimana.
Thank you. Well, what more can we do? To me is to be kind to each other,
Yes.
to know that it's all of us are being affected by this. We reach out and help people. We know that a problem shared is a problem halved. Reach out to people, and if you have the opportunity to listen to them and support them, that will be helpful. And at the end of all this, we need to be hopeful. We need to keep a long-term perspective. We need to be more kind and patient to ourselves, because things are difficult, but be more patient or kind with yourself, and maintain an unyielding attraction for life at the end of this. This is not the first pandemic that's happening in the whole world. It's happened before, and people were able to survive. So let's be hopeful, and let's draw upon the values and have faith in those who inspire us. Thank you.
Thank you so much, Dr. Benedict, and thank you for being a panelist in this. Dr. Hafsa.
Thank you very much, Dr. Kalani, and all the people on this panel. My takeaway, my answer to Dr. Kalani's question, just briefly trying to, I think what I have learned is that we have not yet explored all the available resources that there are, because I'm sure there are so many people who can give counseling, professionals at that, moreover. And there are many things that can be done to actually keep or maintain our mental health. We've heard about the exercises, we've heard about those skills that we just listen to from abroad, from out of the country. They talk of the breathing exercises, they talk of all those things. They've been done before by many people. And somehow we've also been told about them, but we've never practiced them, and yet they are helpful. So we should look out for those, non-medical things that can really help us to keep our mental health well. Then before I go, kindly allow me to share with the group, those that are dying, like they cannot find where to find a counselor, or they've looked through all the counselors and somehow none of them has been helpful to them. Kindly call this number. For those that have smartphones, there is a number that is *252 *10#. I can say it again, *252 *10#. You will listen to a counselor. They will take you through the process, and you will eventually share or get someone that can help you. The other number is a toll-free number. It is 0800 21 21 21. So those are the toll-free numbers that are currently available and are being used by people out there to help with, in case you have a problem that requires counseling. So with those many words, I want to say bye to everyone and wish you the very best. Thank you very much to all the organizers of this conference for having thought about mental health as an important issue. Thank you, and bye-bye.
Thank you so much, Dr. Hafsa, and indeed, bye-bye. So finally, Barbara, just in 1 minute.
Thank you, Dr. Kenneth. it is amazing how counseling, for, I don't want to say for the very first time, for this time round, has been put as a priority in helping or handling the epidemic. And what I could say for us, what we have not done, or what can we do to better the situation, I think we need to come up strongly and advocate or insist that every testing center or every implementing partner has a counselor right from the start of testing for COVID-19, because we have noticed that that is where the problem starts from the testing area. When the person is tested and results are given in whatever way they are given, then the problems start from there. And it shouldn't come as an alternative, but it should be, counseling should be embedded in every step of the way, whether it's home care, whether it is in isolation centers, whether it's in with patients in ICU, the families that are having their people in ICU, in every step of the way, we should be embedding counseling in there. And I request that we opt for professional counseling, not for life coaches, because it could trigger here and there a few of those things that we may not really want to address. The other thing is to be available to help, just like Dr. Benedict said, because sometimes when we are called on to help, we fear for ourselves, but when we're available to help, then we build the resilience to actually help more when situations like that happen. So I request that when you're called upon to help, or you have an opportunity to go out and help in the community or in the hospitals, let's be available to help. Thank you and bye.
So thank you so much. Thank you again, my panelists, for the excellent discussions we've had. I think we've done justice to the topic. And I want to thank the attendees also for attending and being very, very active. I think I hand over to the session host